Thank you, everyone, for jumping online here. Presentation overview, as Scott mentioned, we'll do a quick overview of the four C's, so our quarterly results, as well as looking at some strategic outlooks and in the year ahead and our milestones. We'll skip our business model a little bit, but we're focused on growing revenues, gaining efficiencies across our divisions now that we're in market in a lot of products with our lead regenerative tissue product called CardioCel, and then commercializing Ian Fraser's next range of vaccines as treatments against infectious diseases and cancers. Really, the highlights from our 4C is a story of growing revenues and decreasing costs. We've achieved year-to-date sales of 9.7 million, which represented a 49% growth in year-to-date sales. So very strong sales growth for us this financial year. Our quarterly sales were also an increase over the corresponding period. It represented our 10th straight quarter of sales growth, and we anticipate that is going to be continue in the fourth quarter and into next financial year. We've achieved operating efficiencies in the quarter, so we've implemented cost containment programs earlier in the year. We're starting to see that paying dividends in reduction of costs. For instance, 16% reduction in staff costs in the quarter, 7% decrease in working capital. So we're really focused on growing that revenue, quarter-on-quarter sales growth, while implementing cost containment strategies and overall efficiencies. R&D spend, again, was 1.1 million in the quarter. These are really designed to develop and progress our programs to get us into that position of increasing our revenues, getting into that cash flow position in future years. So these are all very large target markets that we're investing in R&D. Highlighted in regenerative medicine with our aortic heart valve reconstruction study. That's a key study. I won't spend much time on the remaining R&D efforts, but just focused on our aortic heart valve reconstruction study, 80-patient study, 4 leading heart centers in the world, really designed to position CardioCel as a leading valve tissue to reconstruct valves versus needing replacement valves throughout their patient's lifespan. Other products coming onto market this year, vascular products, and then further progressing our pipeline in additional large target markets. Immunotherapy is really key focus around our phase 2 in genital herpes as a treatment for genital herpes. We announced positive blinded data interim results a few months back, and now we're very excited to announce our unblinded data in that study in the third quarter of this calendar year. So a key milestone for us, as well as progressing Ian Fraser's next vaccine as an HPV vaccine as a treatment for HPV and cervical cancer. So that's getting prepared for a phase 1B study. Strong pipeline across both platform technologies that we're progressing. The story here is bringing additional products to market to put us in that position for further revenue growth, substantial revenue growth, high unmet needs with clinical benefits. Capital management is really focused on, again, cost containments and improving efficiencies across the group. Cash management strategies are in review with management and the board. We're going to continue to do that. We have a number of options in place that we're currently reviewing for that cash management, but really focused on efficiencies all across our sales divisions, as well as manufacturing and further reduction of our expenses. The future is promising for Admedus and our shareholders. Again, we put in that foundation to be profitable, a sustainable business that we're developing. Cost containment and management is key for us this quarter, as well as into next financial year. We have a range of products backed up that are coming out of the market. So off the success that we're having with CardioCel, we have a range of additional adapted products that we're bringing to market for other large target markets. Our infusion portfolio has a very strong pipeline as well, so we expect in forecasting our record sales in that portfolio. It really puts us into that position next financial year with a strong foundation of reduced expenses, reduced expenditures across our divisions with growing revenue. We're also focused on building out additional partnerships in our ADAPT regenerative tissue pipeline, as well as collaborations in our immunotherapy programs. So we anticipate further news flow over the coming quarters regarding those partnerships and collaborations.